Friends, welcome to Time with Thebsian. So today I am going to talk to you regarding hydrocephalus shunts. Hydrocephalus means there is water in the cephalus, head. Usually this condition is seen in children, maybe from the age of day 1 to 1 year, 2 year, 3 year, like that. That is something like a genetical condition. But in adults also this condition may appear later in their life. It may be due to accidents or damage to the head by accident or by punishment by somebody else. So hydrocephalus, water in the head. And what is a shunt? Hydrocephalus shunt. Shunt is only a tube used to drain the water in the head. And as far as the hydrocephalus draining is concerned, a plastic tube or any tube that is inserted in the brain where the water is lodged and drained out of the brain. And this water is not simply water, but we have got cerebrospinal fluid. Everybody has got cerebrospinal fluid, which is drains from the head through the membrane cover of the vertebral column and our spine. Our brain has got cavities, brain cavity, they are called ventricles. It will be just like Nalavalak. And usually that will be, the size of the ventricles will be depending upon the size of the brain. But in the hydrocephalus case, lot of fluid will be produced in this ventricle, and draining of this liquid will be slow, and the secretion of this liquid will be more. So the ventricle will enlarge, accommodate the enlarging ventricles, the brain will enlarge, and naturally in children, since the bones of the head are not fused, the bone also will enlarge. So a hydrocephalus child will have a enormous head, or a head which is not, head size which is not normal. This shunt, or a plastic tube which is used to drain the ventricles or the cerebrospinal fluid, one end will be introduced into the ventricle of the brain. The bottom of this drain tube is connected to a valve, and this valve, the physician can adjust the pressure of the cerebrospinal fluid. So when that pressure increases, then the adjustment, the valve will open and drain the excess fluid down. And the fluid drained is taken by another plastic tube which runs through the base of our skull, under the skin, into our body. So one tube, the proximal tube entering the ventricle of the brain, it drains into a valve which can be adjusted by the physician to adjust the pressure of the valve. So this drain tube can be put in several places, into the atrium of the heart or into the abdomen, or that is in the pleural cavity, or in the pleural cavity but near the lumbar region. So this is decided by the physician who treats the child or a adult. This valve mechanism was a little bigger piece made by metals in the beginning of the invention of the device, but now it is also very small and made up of sturdy plastic. There are different companies manufacturing the valve. A proximal catheter is called the catheter or the tube or shunt, which enters the brain ventricle, and a distal catheter which drains from the valve to the body. Ventriculo peritoneal shunts drain the fluid in the ventricle from the ventricle of the brain to the peritoneal. Some doctors prefer draining these distal tubes into the atrial cavity of the heart. You can see that long catheter reaching the peritoneal cavity, in the pleural cavity, or in the lumbar region of the pleural cavity. So the cavity is called peritoneal cavity, that is in the abdomen. The abdominal cavity is called the peritoneal cavity. You have this. Is everything safe? No. The children, the parents are going to visit the doctor as per his instructions. The child will have a normal growth. Not 100% normal, but that depends on the care and the repeated medical attention required for the baby and given by the parents. For some parents who are staying far away from the hospital, it will become difficult. The cost, the travel, doctor's expense, hospital expense will be a burden on them. So it depends on lot of things. Sometimes the equipment cost may be given by a social organization, but they may not be able to extend further expenses because they may not be able to do by themselves. Always there should be an agent or an agency which will follow the matter. And since these are foreign bodies in the brain, in the body, the pleural cavity, in the neck, the catheter is passing under the skin. In the brain, infection can happen. In the abdomen, infection can happen. So infection is the major problem. That becomes a problem in the hydrocephalus shunt treatment. And the very advice I can give is, if you see or happen to observe a child with hydrocephalus and the parents do not know what to do, kindly advise them and help them through a service agency. Our government is doing lot of service to the poor people, extending free hospital facility, free service by purchasing the device and further care for the poor people. So do not worry about when you observe anybody having a children with a hydrocephalus head problem, kindly be in the service board. Kindly spend half an hour for them. And I told you the Earlier the valve was made up of metal. Now it is made up of plastic. The shunts are also made up of plastic, and costlier shunts are made up of silicone tube, while other less costly tubes are made up of class 1 PVC or some other standard medical device tubing. So friends, I am winding up my presentation on hydrocephalus shunts. It is a common occurrence now. I think you go to any hospital, you will be able to see a patient. The equipment costs have come down. Equipments are available at a different cost, and most of the equipments are safe and easy to use by the physician. Only thing is that the caretaker needs to keep an eye on the patient every day and regularly. Make sure that the patient attends the next date of appointment with the physician or the surgeon, and take appropriate action to control the infection. And some people have body pain or neck pain or vomiting tendency. So all these have to be described to the patient and the doctor and get the remedies to the patient. So I am winding up today's discussion. Kindly write to me, ask for your doubts, call me without fail. Do not hesitate to call me. So thank you for watching the video, and kindly share it with your friends, like the video and subscribe.